Hey, Dr. Dusty here. So I'm going to go over some things regarding your digestion and the large intestine, okay? So first off, you have the stomach, then you have the small intestine that's in the mid-gut area, and then you have the large intestine. And the large intestine basically has four major parts. You have the ascending colon, which is on the right side here, comes up, the transverse colon, which goes across, and then the descending colon, which goes down, and then the sigmoid colon, which goes in that direction, kind of angling down and out, okay? So those are the four major sections of the large intestine. Now, the large intestine is about 5 feet long and 3 inches in diameter, something like that. It's named as the large intestine, or can be referred to as the large bowel. All right, to point number 3, the functions of the large intestine is to absorb water and electrolytes, and that is electrolytes like sodium and potassium, magnesium, and calcium. It actually produces and absorbs vitamins. So there's actually a production of vitamins that occurs in the large bowel. And that's primarily a result of the bacteria that are present. So it's the bacteria that are actually producing the vitamins. Now, the next function of the large intestine is to accumulate and, of course, eliminate waste. All right? So point number 4, 700 species of bacteria are located in your large intestine. And just as a side note, antibiotics actually disrupt that normal bacteria balance. So that's why it's encouraged when you are on antibiotics, you take a probiotic to start to replenish and restore the normal bacteria. All right, now, number 5. There's 3 areas of nerve supply into the large intestine. You have the vagus nerve, which is in the upper cervical spine, the brain stem. That's where it comes from. The pelvic nerves, which are down here in the pelvic area, down along the tailbone. And then lastly, you have the thoracic, lower thoracic, which the thorax is here. So the thoracic spine is basically from your shoulder area down to the lower part, or the kind of the upper lumbar spine area. So you got the lower thoracic and upper lumbar is the nerve supply, okay? So, and point number 6, chiropractic adjustments can absolutely affect the function of your large intestine by adjusting your upper neck, by adjusting the pelvic area, the sacrum, by adjusting your lower thoracic and your upper lumbars. You can begin to alter for the better the function of the large intestine and the overall digestive capabilities of that person, which can of course help and influence a lot of things in the body, because you want to make sure that they can actually absorb the water and electrolytes, produce their own vitamins and absorb them, and get rid of the waste. All right, so what we're going to do now is I'm going to go over the areas that we adjust of the spine, and also utilize some pressure point therapy in showing you what we do to help people function better with regards to their large intestine. So we'll see. All right, I just went over some data on the large intestine. So now I want to demonstrate to you some of the things that we do here in the office to help the large intestine function better, okay? So first off, the nerve supply into the large intestine is coming from the upper neck, kind of the lower thoracic, upper lumbar spine, right through this area, and then the tailbone area, kind of the upper part of the tailbone in this area. So doing pressure point therapy is, of course, applying pressure in the upper neck, holding the pressure for about 10 or 15 seconds for each point. And again, the upper cervical spine is right in this area. All right, and then I do the pressure point therapy in the mid to lower back there. Let's go in the mid back here. Well, the kind of lower portion of the mid back. How's that pressure there, Cameron? That doing pretty good?
Mm-hmm.
Okay. All right. That one okay too?
Mm-hmm.
Okay. Okay, so those are the basic pressure points that you would do for the large intestine here, the lower thoracic, upper lumbar spine here, and then it's really kind of hard to do the pressure points on the tailbone. You can do those, but sometimes you're pushing on some bones there, so it can be kind of uncomfortable for the person. All right, so that's a demonstration of what we do with the pressure point therapy with the large intestine and helping that function better. Now, part of the adjustments are kind of adjusting that again, the lower thoracic area. So go ahead and take a deep breath in and blow it out. Okay, good. All right. Many times I'll actually use my drop mechanism on my table here. So okay, let that relax right there. Okay, good. All right, good. Okay, so we're going to see what we need to do with that lower back. All right, so I'm going to have Cameron kind of roll onto her right side so that I can adjust this left sacroiliac area here. So go ahead and roll on your right side there. Okay, good. Now let's bring your leg up here. All right, so let's just roll you a little bit. I'm going to adjust this SI joint here, sacroiliac joint. Here we go. Oh, there it is. Okay. All right, lay your back. That was a little bit out of alignment there, wasn't it?
A little bit.
Okay. All right. So, okay, right there. So this, again, this area is the upper neck. It's where the approximately where the vagus nerve comes from. So we're going to adjust that upper cervical spine. Here we go. Good. Okay, and to the right. There we go. Oh, good. So how's that feel there? Pretty good.
Mm-hmm.
Okay. All right. So that's what we do with the large intestine for the adjustment. Now, actually, there's some pressure points that I do here in the office too, especially if people are having constipation. There's the, of course, the ascending colon, the transverse colon, the descending colon, and the sigmoid colon. So if a person is constipated, you can actually do pressure points going in the direction that the waste matter goes. And this can be a pretty tender area. And Cameron is smiling there, hitting some pressure points there. All right. And if the person is constipated, you can do like 10 rounds of this. All right. So 10 times up, across, and down. And if the person is having some diarrhea, I will go the opposite way, up, across, down. So basically, most people have problems with constipation, and so you do it that way, okay? All right, so there you go. So that's what we do here at Mattingly Chiropractic to help people with intestinal problems, large intestine. Of course, as always, the adjustments are only to show you what we do in the office, not for you to do those at home. Chiropractic adjustments are very specific with a specific amount of force, and it should be done by a professional, one who knows how to do it very specifically with the right amount of force, okay? So I look forward to helping people do better with their digestive system, which really plays a big part in how well a person does in life. And so if you have some problems with digestion, give us a call. You can come into the office and have a consultation, and I'll sit down with you and go over the things that we can do to help you feel better. So give us a call and look forward to helping you feel better. Thanks.